Hello, friends. Welcome to another episode of NTB Dialogues. Oh, as we know that we are almost at the midpoint. Actually, we just passed the midpoint since the government's committed to NTB in 2015 by adopting the SDGs. So NTB by 2030. So we have passed 90 months. 90 months are left, and governments and others will also meet in New York at the UN high-level meeting to review the progress. So we have amongst us one of the fierce advocates for NTB from Lebanon. Welcome, Dr. HIAM YAACOUB. She is the National TB Program Manager of Lebanon, a very, very familiar to all those who have been following global TB control. Welcome, Doctor. How are you?
Thank you, Bobby. Thank you very much. Thank you for inviting me to this interview and to give me this opportunity to raise the voice of Lebanon and the voice of TB community. Thank you.
Welcome, Dr. YAACOUB. It is always such insightful for all of us to hear issues which are very unique to the context of Lebanon. And so without any further ado, and especially for those who may have joined us new, so people you may be knowing that Dr. YAACOUB is a very senior specialist in respiratory medicine and TB at the Ministry of Public Health of Lebanon since 1994 onwards. She's a WHO TB and drug-resistant TB expert, as well as a noted part of Lebanese Pulmonary Society and Lebanese Order of Physicians since 1993. So again, a great honor to have you amongst us again. Dr. YAACOUB, welcome again. So thank you. So Dr. YAACOUB, please tell us, where are we? Since I think the last time when we spoke, it was in 2019. So it will be great to know a lot has happened during that time. So where are we in the fight against TB in Lebanon today? Over to you.
Thank you. Actually, Lebanon is a small country, consists of 500.5 population. But a low burden country, low TB burden country. But the country was hit by many emergencies. First, the war in the neighboring country, Syria, where over around 2 million population refugees left Syria to Lebanon, enter Lebanon. The second one is the COVID pandemic who hit all the world, including Lebanon. The third one is the Beirut port blast. As you all know, we called this blast Beirut Shima as Hiroshima because it destroyed half of the country, including the national TB program premises. The last emergency, and that will impact TB for a long time, is the economic collapse of the country, with its consequences: poverty, malnutrition, poor access to healthcare, and as you may know, poverty and malnutrition and the main social determinant of TB. So here we are in the middle of this.
Yes, thanks a lot for giving that context, Dr. YAACOUB. It is very, very important to understand that TB is a social issue, but it's also a political issue, and so many issues, impact the response to TB. It's not in isolation that we can end TB. So it's very, very, humbling to listen to you, the kind of ground realities which you just shared. So can you just give us an idea of how are people getting diagnosed, which tests are being used, like molecular tests are there or not, which regimens, and despite so many challenges, you are able to do such important work since so many years. This gives us such inspiration and strength. Over to you, Dr. YAACOUB.
Actually, despite all of this, and with the support of our partners, and mainly WHO and International Organization for Migration, with the generous grants from the Global Fund to fight TB, AIDS, and malaria, we have succeeded to elaborate strategic plans to end TB. With time, meanwhile, we are providing OTB services to all residents of Lebanon free of charge, without any discrimination, through 9 TB centers that serve as a primary healthcare specialized for TB. These centers are distributed equally to all regions of the country, and they are equipped with digital X-rays and with PCR for TB named Gene Expert. Actually, we have 4 X-rays, and 2 of them are equipped with AI, CAT for TB, with artificial intelligence to help better diagnose TB. And with 4 Gene Expert for reefer resistance, MTB Reef Ultra, distributed to 4 regions that cover all the country. And we have more than that, we have 1 Gene Expert called 10 color of XDR Gene Expert, when we can diagnose in 1 day that all presumptive MDR TB cases can be diagnosed in 1 day and provided with the oral short regimen, even with an individualized regimen on the same day to all eligible for this treatment. In addition to that, we have recently elaborated a national strategic plan to eliminate TB in Lebanon. And our main focuses were on TB in children, multi-drug resistant TB, and TB infection, which is the driver of the disease. And what actually that is, I think, the answer for your question. If you have more, please.
Yes, Dr. Yacoub, thanks a lot. It's absolutely unbelievable for people like me to understand, like, despite so many difficulties, you are able to provide such cutting edge technologies and services despite challenges too. So this really is so inspiring and gives hope, lot of hope. So Dr. Yacoub, in India, we as per in last year 2022, we diagnosed 23% of presumptive TB with molecular tests. 77 got the sputum microscopy. So it's increasing in different states. In some states have 100% use of molecular tests. Some states have lower, but it's on a rise. So just wanted to, and most of the molecular tests in India are done by TrueNat. So this is a point of care, decentralized, battery operated, and more, given the situations of electrical supplies or other infrastructure issues, probably so that is why probably the state governments and national governments might have scaled it up. So I was just wondering if this is of context, if you are also using the point of care decentralized or like that machine, or and also are women and girls more affected because of a range of other issues like migration and others which you just mentioned? Over to you, ma'am.
Actually, we use this molecular testing for TB, and it is the first test for us, but mainly used in pulmonary TB because of the simplicity to get a sample from the patient. When we have reached more than 90% of our pulmonary TB cases are tested by this test, and they are distributed to actually, Lebanon is a small country. We have 4 regions, and we have 1 Gene Expert per region. And we have settled with the support of our partners a transportation system. So we have twice a week, vehicle will go and collect samples and to the referral lab, to that central unit of the TB program, to the nearest center where expert is available. I told you that no discrimination, but women, children are all served in the centers. But yes, we have more percentage of cases in women not in Lebanese and refugees, because they are here. Refugees are, you know, at and they are familiar with the language is one. Everything is similar between these two countries. So we don't have this limitation. But the highest number of women are in migrant population from high burden countries, because they are women. They are homework, they are working in homes, they in homes, they are women. Here we have higher percentage of women over men, only in migrant population. But they are served and provided with all the needed services to get out of TB, free of TB. And this, sure, with the support of our partners.
Thank you. Absolutely, totally agree. With this kind of support, of course, like people will more likely to finish the treatment and get cured. And this is that is again underlines the importance of support and care during the therapy. And it's interesting to know that more women get impacted by TB. In many other settings, it's the more men probably get TB, but it is maybe the bacteria does not distinguish, but whatever. In India, Dr. Yacoub, there is a very interesting data which I was seeing. There is of the national government data. It's also segregated by gender, and you will find more completion rates, more successful completion rates, more adherence by women than men. Even if there are less women who get diagnosed, but still if they get diagnosed, they are more likely to finish the treatment. So more responsible.
Yes, I think, yes. Don't be upset of me, but when I work even in the health sector, women are more organized. Sorry for that.
Yes. No, sorry. You should be proud of that. And we are too. So thank you for your leadership. So Dr. Yacoub, what about the treatment regimens? Are the latest regimens being used? Can you please enlighten us? And also on the latent TB. Over to you.
Actually, we have just finished our national guideline, updated guideline for drug-sensitive TB and for latent TB. And we have included the new protocols with rifampicin, 4 months shorter regimen, as well as for latent TB, the 1 month or the 3 HP or 1 HP, maybe you are aware about. And we have included, but now we have issued the guideline. Now we will wait for, as you know, procurement of the medication. And I believe we will start from the next year to provide this treatment.
Yes, this is good. In India also, these are announced, but not yet rolled out. So probably at some point in future, let's hope that new regimens for latent TB, the 4 month for drug sensitive, and 6 months for drug-resistant TB, the BPAL and BPALM, become a reality for people who need it. Anything else which you would like to say in terms of the next 90 months? So Dr. Yacoub, you have spent so many years fighting TB in the past. What about the next 90 months to 2030? So what can be done more? What can be done differently so that we are really able to, end TB realistically?
Actually, I would say, and I would ask the leaders who will meet next month at the UN high-level meeting and the special one for TB, to put TB on the top of their agenda, and not only by signing declarations and commitments to support us by developing ambitious strategic plans, but by securing funding for us to implement these plans and to reach our goals and vision of the world free of TB. I would ask them to make all the newest TB diagnostics, medications, preventive tools to be accessible to all in all the country, and including the expected vaccines. We are expecting in the very, very near future a vaccine. I would ask them to make it available to all over the world. I would ask them, in addition, to fight and to secure funding to fight the social determinants, as you know, the social determinants, poverty, the malnutrition, they are the real driver of the tuberculosis. And this is my asks for them, like Stop TB, they have their ask. I have this ask for the leaders to help us to end this terrible disease before it becomes a pandemic.
Thank you. I can only say one word, Amin. Let's hope that this happens. Absolutely, this needs to happen. And thank you, Dr. Yacoub, for mentioning that it should happen everywhere. TB anywhere is TB everywhere. That is not only just a slogan, that it is so true. And so thanks for saying that. Before we wrap up, Dr. Yacoub, is there anything else which you would like to share now?
Actually, I would share that we should be ambitious, but we should have the needed support. We are working in our region now, in a region with ongoing conflicts everywhere. So we are facing security issues, new and movement of refugees. And I would ask, to stop these wars. We are working in very challenging environment, and we cannot work forever in this situation.
Right. Totally. We are with you. And I'm sure that every human being will echo what you have just said. Peace is so central, and that is to health. And of course, like health is also very central. And we saw what pandemic did to economies, trade, businesses, everything collapsed when the pandemic had hit us. Health security is important, but peace is so vital. And let us hope that what you have just said also happens. Friends, we should also remember what Dr. Yacoub has just said, that the governments, by adopting the Sustainable Development Goals, have also adopted, there are targets to end hunger. So she's talking about ending malnutrition. She's talking about peace. There are Sustainable Development Goals related to peace. So we need to ensure peace, socially just and ecologically sustainable progress, and the response to TB needs to be rooted in that. So thanks again, Dr. Yacoub, always an inspiration, personal inspiration as well, to hear you. And our deepest regards to the years you have put in the fight against TB. And we really hope that your efforts will bear fruit, and we one day will see that this pandemic, the TB pandemic, behind us. So thanks again for joining us. Friends who have joined us late, thank you.
I would say one more. Thank you, Bobby,
Yes.
for your interest, for your support for TB communities. Please keep it up. Thank you.
Thank you so much, Dr. Yacoub, again. Thanks a lot.